Historically, when we used to do stem cell transplantation, whether autologous or allogenic, it was thought to be a sort of a single shot approach. Either you win or you fail. Now these days, actually, stem cell transplantation is becoming a platform for actually continuous therapy. So you build on transplant. We know very well, in auto transplant for myeloma, for example, now there is no debate about the need for some maintenance therapy. And we know that lenalidomide is approved as a maintenance therapy in multiple myeloma after autologous stem cell transplantation. And this is until disease progression, because you have an overall survival benefit. The same is true actually in Hodgkin lymphoma, and we have seen in this meeting some consolidated data about the ITERA trial about the use of brentuximab post-auto transplant for Hodgkin lymphoma, again highlighting the benefit in terms of progression-free survival. But now we do have emerging and quite strong data in AML. Let's talk about FLT3 ITD AML. Very bad AML entity, very bad prognosis. Usually these patients are candidate to allotransplant, and usually the relapse incidence after allotransplant is quite high. But now we have data suggesting that using FLT3 inhibitors after allo in these patients can improve the survival of the patient. So you can see, I think, again, in different diseases, the concept of continuous therapy, whether consolidation or maintenance, is now being more and more recognized. And I believe this is probably the way to go if you would like, over the long term, to keep control, to keep the disease under control, and hopefully eradicate it.